In this video, I'm going to go through the complications from a brachioplasty or arm lift surgery. It's important that we know that it's not just one operation, it's actually multiple different operations that are a brachioplasty. So we have the menial limited, which is just in the armpit. We got the from elbow to axilla, so that's a full brachioplasty, or the extended brachioplasty, which is the one that goes across the chest wall. A brachioplasty surgery can have a variety of different techniques. So we got the limited, the full and extended. Brachioplasty is a cut in the arm, so you will have a cut, you will have a scar. Can be done as a standalone procedure, or you can combine with other body procedures. So you can combine it with a mastopexy or breast reduction mammoplasty, or you can combine it with upper abdominal apectomy or other body contouring surgery. And really with post-weight loss patients, it's very common to have multiple areas of issues with skin. And that's why the consultations that I do are really, really important. Now, why do we usually discuss the complications? Because the complications do happen. There are some that are very, very common, and there's others that are less common. But if you know what to expect, what to look out for, what to expect after the procedure, then that's really, really important. The overall complication rate for brachioplasty is around 20 to 40%. Most complications are minor and are manageable. However, some can be more serious and need more long-term treatments. By far the most common thing is wound breakdowns. Everyone gets some sort of minor little wound breakdown. The bigger the incision, the bigger the likelihood of a wound breakdown. So if you're having extended brachioplasty, then certainly that is more likely that you're going to get an issue from wound breakdown from that. If you're having a full brachioplasty that goes from the elbow to the axilla, then you're probably going to have a less likely that you're going to have wound breakdowns. If we add liposuction or suction-assisted lipectomy, you may have a few little extra wounds from the liposuction cannula. So those are all important. If you get a wound breakdown, then most of the time it's conservative management. We dress it, we wait for it to heal. Sometimes if it's a bigger one, then you get granulation tissue or the proud tissue coming through, and then we can close it in surgery. So that's kind of the minor one. The next one that we want to talk about is the bleeding and hematoma. That's fairly rare for a brachioplasty to have a significant bleeding or hematoma, but it can happen. If it happens, then it's really important to take you back to operating theatre to fix the bleeder, because otherwise the arm swells up, you can get constricted blood supply, it can cause problems with wound healing. So there's certainly something that can be quite important to deal with early rather than wait too long. If there is bleeding, most of the time that occurs within the first 24-48 hours after the operation. And that's another reason for having really tight follow-up lines and coming to see us in the practice, calling if you're worried about something, because we need to manage these complications. The incidence of a hematoma is from 1 to 5%. Sometimes if there is a really small one, we can manage that without having to go back to operating theatre. If it's a large one, then we definitely have to go back and deal with that. Seroma can also be an issue with the arms, obviously less likely because there's less space there. But a seroma is a fluid collection, and if you get a seroma, we have to put a needle in and aspirate the fluid. So that is something that can happen afterwards, and that's something we pick up afterwards in the office. Infections are fairly common, so you got superficial wound infections, and that's usually oral tablets, or deeper infections like collections or abscesses. That's a more serious problem and may need surgical treatment. So we need to open up the wound, wash it out, take swabs, keep you in hospital under IV antibiotics until everything settles down. So that's certainly a significantly more serious issue. Deep infections are fairly rare, thankfully, but they do happen, and probably a range of 1% or less. As I spoke to before, wound breakdowns are by far the most common issue that we deal with. Most of the time it's minor ones, they're a couple of millimeters, maybe a centimeter. The wound breaks down, you see the tissues underlying it. Most of the time we manage that conservatively, like dressings, usually a combined dressing that absorbs the fluid. Sometimes you have to do the dressings at home on your own, and then gradually that fluid reduces, the wound settles, and then we can look at maybe closing the wound later on. Wound complications are reported as 10 to 25%. Most are minor and most are conservatively managed. One of the things that I really emphasize to patients is that rushing you back as soon as there is a wound breakdown is not going to be the best action, because the wound has broken down for a reason. If you try to just stitch it together, it's just going to break down again. And that's something I've experienced a long time in my career, that you don't touch those wounds because they're just going to cause problems. What you do is you do the conservative management that allows the tissue to heal up, to clean up. You keep it really clean, you get the granulation tissue, the blood vessels coming in, and then you can consider closing it. Most of the time, if that is the case, then you're actually at a stage where the wound has almost healed up on its own, so you don't actually need to do anything. So, seromas we've talked about. The other things are nerve issues. There's not uncommon to get a few nerve patches that are numb after brachioplasty surgery. Most of those return. Sometimes if you're unlucky, you can get chronic pain, shooting pains. You can get what's called a neuroma, where the nerve sort of shrinks down and has pain when you touch it. And that is a fairly rare one. That's less than 1% chance of that happening. But certainly numb patching, shooting pain, some sort of nerve-related issues are not uncommon in the initial period of recovery. That kind of is an overview of all the complications that can happen. I've got separate video on the recovery for this operation as well. So check that out. I think I've linked it down the bottom or in this video, so make sure you have a look at that. And come and see me. Brachioplasty is a really common operation after weight loss, and it can relieve some of the functional issues that can happen with loose skin on the arms.